timekeeper. Please try to pay attention and criticize both of them.
أنا طبيب بيطري، طبيب طب باطني، طب نفسي. هل راح أسأل بعض الأسئلة؟ وش اسمك؟
اسمي محمد خالد.
كم عمرك؟
35.
كم هل أنت وش وظيفتك؟
وظيفتي سائق.
هل أنت متزوج؟
متزوج ولدي طفل.
كم عمرك؟
عمرها 6 سنين.
طيب هل
Please use yes, please, okay. Yes, thank you, Ron. Highly appreciate it.
طيب وش اللي جابك اليوم؟
جاني دكتور إن قبل شهر صار لي حادث، ومن بعد هذا الحادث شهر تقريبا بديت أعاني في النوم، صرت ما أقدر أنام، وإذا نمت أنام ساعة وأصحى وتجيني كوابيس، وغير هذا تجيني مشاهد مزعجة، نفس الصورة ترسم قدامي بالحادث اللي صار.
طيب متى بدأت الحالة هذه معك؟
بدأت بعد شهر من الحادث.
كم صار أو عفوا ممكن تشرح لي زيادة وتعطيني فكرة عن الموضوع؟
طيب.
Kindly, both of you, just make the microphone like this. You know, put your thumb at your chin. That will make, you know, life easy for all. Please just raise it, just عشان الناس تسمع.
اوكي. بدأت الدكتور بالمشكلة بعد ما طلعت في يوم عادي طبيعي الصباح، أوصل العميلة ومعها بنتها توديها المدرسة، فمشيت في طريق عادي أنا عارفة، ما كان في زحمة، وقفت في الإشارة طبيعي، فتحت الإشارة ومشيت، التفت على اليمين اللي تجينا شاحنة مسرعة بسرعة جنونية، قاطع الإشارة صادمني من جهة باب العميل. فوأنا ملتفت شفت المشهد كامل قدامي، شفت العميلة وهي تتقطع، طفلها وبنتها تتقطع قدامي، الأشلاء والطاير، ما كانوا رابطين الحزام الأمان، فكان مشهد مرة دموي قدامي. ففجأة كذا شاشة سوداء، صحيت إلا أنا في المستشفى، أحس كامل جسمي فيه آلام إلا يد اليمين حسيت فيها ألم غريب، أناظر فيها ما هي موجودة. فبعدها عالجوني، أعطوني أدوية، كان عندي كسور في الضلوع وبعض الكدمات، وأعلنوا وفاة الأم والطفلة، ورجعت البيت.
الله يرحمهم إن شاء الله. طيب كم هل الحدث هذا أثر على حياتك ولا لا؟
إيه أثر جدا. ما صرت أقدر أدي عملي، ما صرت أقدر أسوي عملي وظيفتي، خلاني أتجنب عيالي، ما صرت أنام زين، فصرت مشاكل كثيرة.
طيب أثر على بالنسبة للأهل، أثر مثلا على بالنسبة لأهلك كزوجتك؟
إيه أثر، لأن تعرف دكتور كل ما أشوف بنتي أشوف زوجتي أتذكر على طول الأم وبنتها، على طول يرسل المشهد قدامي، وبعض الأحيان صرت أعصب، أصارخ على بنتي وهذا مو طبيعي ومو طبيعي.
طيب هل بالنسبة تحس إن المشكلة زادت ولا؟
هي زادت. صرت إذا شفت مثلا سيارة، صرت ما أقدر أركب سيارة، هذا أول شيء. إذا شفت سيارة أو شفت واحد يسرع، على طول أتذكر الموقف وأعتذر.
وش اللي تحس إن اللي مثلا يخففها واللي يزيدها؟
هو ما في شيء يخففها، جلست على أدوية منومة 3-4 أيام، قدرت أنام بعدها ما عاد تعاطيت مفعول.
اوكي، ممكن وش الادويه اللي اخذتها؟
بنادول نايت وميلاتونين.
ميلاتونين. كم استمريت على البنادول نايت والميلاتونين؟
بس لمدة 3-4 أيام وأنت ما عاد صار تعطي مفعول.
حتى الميلاتونين؟ طيب هل في مثلا اسمح لي بس انا عندي اسئله خاصه، وزي ما انت عارف يعني الامور راح تكون سريه بيني وبينك. هل كيف علاقتك مع والدتك ووالدك؟ هل هم عايشين؟ هل مثلا علاقتك مع اخوتك؟ هل كلهم عايشين؟ اعمارهم كم بالنسبه للوالد والوالده؟
لا دكتور، أنا يتيم. الوالد توفى وأنا في المتوسط أدرس في سن ما أذكر، كان فوق 50. والوالدة توفت قبل 7 سنين جلطة، كان عمرها 66 65. وعلاقتي مع إخواني جدا كويسة قبل الحادث. بعد الحادث صرت منغلق أكثر منعزل معهم.
الانعزال هذا هل هو اثر على حياتك ولا تحسن؟
ما سمعت إيش؟
الانعزال اثر يعني على حياتك؟
إيه، أثر على روتين يومي، ما صرت أقدر جالس في البيت. بالذات دكتور الأماكن البعيدة من البيت ما أقدر أروح لها، لأنها تحتاج أو تتطلب إني أستخدم سيارة، فأضطر إني أستخدم مشي.
طيب ممكن توضح لي يعني كيف انها اثرت مثلا بالنسبه يعني نفس هذا المشهد اثر على الشيء الاجتماعي اللي عندك، واثر على اللي هو عائلتك زي ما قلت لي وحياتك والنوم. لكن هل مثلا راودتك افكار، او مثلا حسيت انك مثلا اذا وانت تيجي بتنام مثلا انك تحس انك مثلا ليتك تنام وما يعني الله لا يقول مثلا لا تصحى، ومثلا الشغف ما في شغف ما في طعم؟
فكرت زي كذا دكتور، بس صدق ما فكرت بهذه الطريقة. أنا فكرت إني يعني أعوذ بالله، بس فكرت إني أكون مكان العميلة والعميلة مكان.
خذ راحتك ابد، تفضل.
فهمت؟ يعني تمنيت إني أكون أنا مكان العميلة والعميلة وبنتها قدام، لأنها سبب لي تأنيب ضمير كبير في حياتي. إني أنهيت حياة زوجة لشخص وطفلة، زي ما عندي أنا زوجة وطفلة.
طيب هل بالنسبه هل في مشاكل عائليه مع الزوجه؟
لا، بس زي ما قلت لك دكتور إنه صرت أعصب على أشياء تافهة مع زوجتي ومع طفلتي. وهذا ما كان طبيعي كذا، بس بعد الحادثة صرت أتفه الأمور أعصب عليها.
كيف كان وضعك قبل الحادث؟
كان جدا مرتب، كان كل شيء تمام، كل شيء مضبوط، ما كان في أي شيء، بالعكس كانت 100% بيرفكت.
ان شاء الله نتابع يعني. طيب هل راح اسالك اسئله شخصيه شوي؟
تفضل.
راح تكون سريه بيني وبينك. هل مثلا حاولت تحل المشكله هذه باي طريقه؟ ممكن زياره دكتور من قبل او؟
لا، هذه أول مرة. واجهت صعوبة أصلا عشان أوصل المستشفى، بحكم إني ما أقدر أستخدم السيارة. استخدمت الإلكتريكال اللي تكون بالشوارع يحطونها، الإلكتريكال سكوتر. استخدمتها عشان أوصل، وأخذ مني وقت شوي.
يعني أنت جاي اليوم لحالك ولا معك أحد؟
لا، جاي لحالي.
جاي لحالك اليوم. طيب هل واجهت بالنسبة هل أنت مثلا تستخدم أدوية مثلا إنك تعالج غير البنادول والأشياء هذه؟
لا، ما استخدمت أي أدوية.
طيب هل تستخدم المشروبات الروحية أو؟
وعادي يقول دكتور؟
إيه عادي براحتك.
الأمانة بعد الحادثة حاولت إني ألجأ لهذا الكحول بس عشان أنسى، يمكن يساعدني في النوم.
ممكن تقول لي وش الكحول؟
فودكا ومرات بس بالذات.
كم الكمية؟
كنت أكثر يعني ياخذ 3 أرباع الزجاجة في يوم واحد.
طيب طيب هل أنت مدخن؟
أي.
كم باكت في اليوم؟
أنا كنت أدخن دكتور أول خفيف مرة، يعني كنت أخلص نص باكت في اليوم، الحين صرت باكتين 3 في اليوم بعد الحرب هذا.
طيب ممكن تحكينا عن طفولتك؟ كيف كانت؟
كانت زي طفولة أي طفل عادي. عشت حياة كريمة مع أهلي، مع إخواني، ما كان فيها أي شيء.
5 minutes more, no problem.
أي شيء.
طيب هل واجهت عفوا هل تحس ان مثلا انت قلت لي اني انا اشوف مشاهد او احلام ممكن تشرح لي وش المشاهد وش الاحلام؟
نفس اللي شفته الدكتور في الحادث يرتسم قدامي، أشوف المشهد كأنه قدامي.
وش هل هي احساس ولا مثلا خيال انك تشوفه قدامك او كذا؟
لا كذا خيال يرتسم قدامي، أشوفها بنفس الدمعة نفس التغطية اللي شفتها.
طيب هل عندك امراض مزمنه؟
لا الحمد لله.
الوالد الوالده؟
لا متوفي.
الله يرحمهم. اي بس هل كان عندهم؟
الوالدة بس كان فيها سكر نوع ثاني.
والاخوان؟
لا الإخوان الحمد لله كويسين.
الحمد لله. طيب انت بالنسبه لحياتك الاجتماعيه انت ساكن وين؟ انت من اهل الرياض؟
في الرياض.
طيب ساكن في بيت في
لا بيت
ما شاء الله. لحالك ولا معك احد؟
أنا وزوجتي وطفلتي والخال.
طيب الله يخليهم ان شاء الله. طيب بالنسبه علمني وش اللي انت مثير قلقك يعني الفتره الاخيره؟
اللي مثير قلق يا دكتور إنه صار يعني يعيقني هذا الشيء، ما أقدر أسوي الأكتيفيتي الطبيعية حقتي، بالذات الأمور المادية. بعد ما تركت الأوبر بدأت تنزل وصار الاعتماد الكلي على زوجتي، فصار عليها ضغط، وهذا غير انعزالي يا دكتور، وهذا غير إني ما أقدر أنام زين. يعني تقريبا أكثر من ناحية.
طيب هل عندك مشاكل ماليه الفتره هذه؟
بدأت تنزل
مشكله كبيره يعني ولا؟
تقريبا.
طيب الله يسهل. طيب في طيب عندي مجموعة أسئلة.
تفضل دكتور.
اللي هو بالنسبة أنت عارف أنت عارف الآن يعني إنك في العيادة صح؟
أي.
هل تجيك الحين خيالات؟ تسمع أصوات غريبة؟
لا الحمد لله.
طيب تحس إن ممكن تحس إنك أفضل من إخوانك؟ يعني تحس إن فيك طاقة أكثر من إخوانك؟
لا طبعا.
تحس أو مثلا تحس إن كيف مزاجك؟
سيء.
نازل شوي؟
جدا دكتور، شخص ما يقدر ينام.
طيب طيب
1 minute.
اوكي هل عندك اي استفسار اخر؟
لا ما عندي استفسار.
طيب اوكي الحين اعطيها اوكي انا بصل لك ادويه زين وان شاء الله انك يعني تتحسن من الامور دي وعليك يعني بالامور الروحيه بالصلاه والامور دي
طيب دكتور، خصوصا الأدوية هذه هل راح استخدمها طول عمري بقية عمري كاملة؟
لا لفتره معينه.
بس لفترة معينة.
فتره معينه ما طيب. طيب عندك استفسار؟
لا
شيء اخر؟
عندي استفسار.
قدامك العافيه ووضعك ما
Okay, thank you very much. أحمد خليل جالس لو سمحت حط على الكرسي. Thank you very much. دخلتما التاريخ أول ناس يعني سووا الرول بلاي. Thank you very much. بالك مكان. Try to just تفتحوا في المجال في المجالس. لا ما عشان ما نشوف العلامة.
خذ كرسي وروح الجهة الثانية. شنطتي.
ايوه تمام. Criticize both or لا انت خربت علينا ارجع.
ارجع عشان ما في على
لا ما فيش المشكلة عشان كيف الناس راح تدخل. Criticize both of them. ارجعوا. عشان غلبنا criticize him. Do you have any criticism on your colleague? طبعا هو لأنه what is the diagnosis? PTSD. So, do you think that أنت ليش كنت ماسك yes.
اليمين مقطوع.
لحظة هو عشان أريح لك. I expect you إنك تقول إنه والله I lost my hand. لكن okay في criticism who said something major things مفترض ما تمشي عليكم. Do you think that this patient has PTSD in front of you? كده first look. Honestly, we are here to learn from each other. His يعني مارك خلاص طلعت يعني your response will not affect my response by any means. Just I would like you to learn. Just this is right, this is wrong. Do you think that for him this is a beat? Do you think that you did well? شوية لازم any criticism?
Doctor, he came after 2 months, so he feel like he can't freely speak. So he was freely speaking, but he looks like he said he takes some gaps between the words when he talk about the death or the flashbacks. Yani, for me, I can give him 8 out of 10.
No, I didn't ask you to rate him. Okay. حسن.
الدكتور بس كان يكون التون أخف.
كان
لازم التون يكون أخف. والله التون طبعا هي I will not accept later on خاصة the patient. You should put the mic like this and please this is take it from now on in your life. If you want to speak in front of anybody like this, put your thumb here on your chin. Okay? Chin and that. So everybody can hear.
مو التون يكون اوضح بدون المايك. بدون المايك الواحد يقدر يرفع صوته وينزله.
بعض الناس ما يطلع صوتهم ابدا. تفضل.
معلش دكتور بس انا استخدمت يد اليمين عشان المايك عشان هذه الأهم.
No problem. No, you should use. كان ممكن ان تكون راحت يد اليسار يعني ما في مشكله.
استخدمها يمين.
ما في مشكله. I accept that. لكن هو كان في major mistakes I expect لكن I will mention that later on. Please all of you مسكين راحت يده هو بس انتم الله يعافيكم ان يدكم موجوده. Please use your thumb on your chin. That will خلاص تريح الناس وكل الناس will hear. Okay, what about the criticism for your colleague, for your doctor, for the doctor? حيوريكم. خلاص ده مع واحد انت
يبي عشاء دكتور.
يا العشاء اوكي.
نضمن اليوم.
Do you think that we want to know, what is the right things or what is the good things and what is that's good to bad, right and wrong? How can he improve himself? Just advise him. We are here a family and we are a group. We want to learn from each other. Again, and his mark will not be affected by any means. Okay.
I think my colleague did a very good job. I think his approach was very good, but I think he could have followed a more systematic approach in taking history. But again, I think he did a very good job.
Okay, any other things?
He needs some work on English.
He was repeating more than one question.
Thank you very much.
again and
Yes, that I know because of anxiety. If I myself be in his shoes, I will have some anxiety. Expect some anxiety, no problem. But he is okay. But he's better. This anxiety reduced his performance in this regard. He repeated some questions because this is the first time. I'm sure the last doctor tomorrow will be, the performance will be totally different. And this is the usual thing. I don't worry, I understand that very well, okay? But your point is very valid. Thank you very much. What else?
I'm having a question, doctor. Are we allowed as a doctor to write a notes?
Yes, please.
That's-
أنا حتى استغربت
gonna
لما
help us.
معايا note. Yes, you're right. Use your this is your as if you are in the room, in the treating room, in the clinic. Please take notes. How come? And you can just have well now he will be in I don't want to say anything, but that will remind you of what's going on. You cannot, especially during the anxiety time, you will not concentrate well. Please utilize, take notes and read from your notes. Some, just to remind you, I don't accept reading, all reading, full reading. You can just take a hint of what you have read. لكن في أشياء أخرى. Thank you very much.
Because he didn't show empathy. He mentioned some critical.
Thank you very much, Hassan. He actually said, well, Salamat. First of all, imagine that when he lost his hand and he was in big trauma, you expect, it is expected from you to show more emotions, more empathy. Oh, Salamat. And you play with your voice, with your tone of your voice. Oh, really? What has happened? He said, Alhamdulillah ala salam, or something like this. Like it is not, he can, this is just the 3-star. 5-star, oh, salamat, wajab, just you can just play with your tone. That will be, that the thing, the interview will be more closer, more intimate. What else? Thank you very much. Valid points, please.
ممكن دكتور بعض الأسئلة sounded like an interview, so if he made it more of a conversation.
بعض الأسئلة كانت إيش؟
It sounded more يعني like an interview إنه قاعد يسأل.
كانت some, yes, you're right. He tried to be kind, and he tried to just, introduce or make soft transition from one thing or this is a sensitive issue. He needs more training on this. So the transition and the soft transition should be more obvious in your interview, so that you can just prepare your patient well before you go. ما عندي شيء كثير لكن تفضل.
دكتور بس اللي هو سواه هسه كان اسئلته اوبن واند كويشن لانه احنا نتكلم اليوم في كلينيك سايكاتري.
He was not that open. He unfortunately his open-ended question was not 100% open questions, and I have a proof. He taught him أنت الآن في العيادة مثلا. صح. This is very major mistake. This is not open. If you أنت في العيادة, the answer is yes. Did he answer? He said yes. If the answer is yes or no, that means a closed-ended question.
بس أنا أقصد إنه سأل بعدها أسئلة كانت open وclose no.
مع الغداء أنت ولا يهمك. But no, I think he can improve these things.
لأن أنا بس
open-ended question first and treat حتى in the beginning, in the history before the mental state. It was some of them. Yes, I agree with you. Some of them was he tried to make it open-ended question. Instead of أنت في عندك مشكلة في الاجتماعية، في عندك مشكلة في كذا. What is the problem? No need to say عندك مشكلة اجتماعية affected أكثر من مرة سأل صحيح؟ أثر هذا على عائلتك؟ Yes. the proper question is how this affected you in general. How this affected you? The answer is not yes or no. I will start to talk how this affected, on my whatever, and then he can say, what about so and so? What? Try to use this real open-ended question.
تمام.
Okay. In general, it was good interview. Okay, but you need to improve yourself on this regard, especially open-ended question, intimacy, and I know that you are a good person. You can just transfer your feelings to your patient, or really as if you are affected.
اتوقع انه دائما اول شخص طلع فارغ قدام.
I told him that. ما نعمت خلاص حطه في قائمة الغداء. هو just he wants to. I know that. I told you that. That the last person who will interview is different from the first person. This is why I thought him هو دخل التاريخ هو صح. Okay, tell me about your patient.
My patient is he has
إن
PTSD.
شاء الله ما أنسى ملاحظاتي بعدين أنا نسيت تفضل.
His name is Mohammed Khalid. He is 35.
By the way, no need to say that I have a name, he's Muhammad, for example, and that is it. No need to mention full name.
Okay.
Try to use this, okay? Muhammad is so and so.
Okay,
طيب
Mohammed.
قبل كمل وبعدين يمكن إذا أعطيك ملاحظتي بعدها كمل محمد.
محمد عمره 35.
No.
Okay, Mohammed, my patient is Mohammed. He is 35 years old. He had some events and imagination of scenes that happened during happened in the event. Yeah, and he imagined that like أوهام illusion.
You need during the formulation to be highly proficient. That means you need to utilize, if you say a word, it needs to be professional word. That means لها دلالة. It has some delusion, hallucination. This is very psychopathology terms. We need to be very meticulous and very careful. But now you are saying that he has delusion. Look, بس قبل أن اعتقادي that time. Please use simple past tense. Again, simple past tense. Simple past tense. That will help you to just present more confidently. Okay? Don't just have been وهاش been وما بعرف ايش or عشان مضيع لأنك تتكلم عن something happened before. That means you are talking about the past and use simple past tense. Okay? Simple past tense that will help you to reach. كمل.
Okay. Mohammed had illusion, and he see. He has memory. He had memory of the event that took place, and he feel guilty.
I will advise you, all of you, and thank you, don't worry, this is just unutilized in this thing. It is just sort of history, story. Tell me the story. Okay? That's happened 1, 2, 3, 4. This is what has happened. And these are the symptoms during this. You can use, by the way, verbatim. Verbatim is just quoting your patient. Verbatim كأنه هو مقولة between قوسين about what he has said. Exactly he said that. If you want to say delusion, you can just say in Arabic أنا كنت شوف مثلا whatever خيالات. So that means like you need to say it in English. And he said it, and you can say that he was mentioning what is, طبعا I'm not saying illusion or not illusion, we'll discuss it later. Okay? But we are, if you want to say something, you need to say, this thing's illusion and this is the proof, because he said, and this is, you can just cut some of his, whatever, that is, we call it verbatim. Just make a story. Okay, this is what I would like to. This is why we are here. This is why we are learning how to present effectively. ما أعتقد تاخذوها في مكان آخر. And now we want to know how effectively present our patient.
The patient imagined imagined of a scene that he said, I'm still seeing it on the in front of the eye. Okay. كان عنده اللي هو والأهل نفسهم عنده مشاكل في he has a problem with a relationship with the family, and also he has a problem with his with the event that took place, and
Yes. كمل. listen.
طيب.
Look, usually if you want to state a story, start when it happened, how it happened, تمام? And then how it affected his life. Maybe this is the best way, easiest way to tell a story. And then you can say professional words, like whatever you said, that illusion, we'll discuss this. Unfortunately, the time is, after us. Please go ahead. Tell me the story, what has happened, and when has happened. It is very important to tell me when. صحيح? The time is very important. And what has happened. And then the effect of what has happened. People should be 3 points. That will make life easy for all of us to describe any event.
Okay, 1 month ago, my patient started. He had this event, catastrophic event, and also this event, which basically is he imagined a lot of scenes and memories. He saw it. Flashbacks. He saw it in the surroundings. Okay, in the surroundings, and also that affect his family relationship, and also affect its mood, his mood, and نفس الوقت هذه بكل بساطة.
You need to work, hard on this. How to make history. How to narrate things. هذه يعلموها بالمراسلين. What has happened, so and so, it was كذا, بعدين the circumstances around, and this is very important. And I think you need to work on this very well. And affected on mood, for example, in what way? So he became depressed, he became very anxious, and if you remember, we should affect it, well, you said that affected his life, affected his family, in what way? judge and you are listening to what's going on, you will see that, well, this doctor didn't give you enough information for him to make a diagnosis. You said that he is PTSD. Okay, give me the evidence during the interview. Give me the evidence during the examination. So you need to collect the information to prove that yes, and you need to mention that, because if I ask you, give me a report about this patient, and you said that it affected his mood, it affected his family, it's not enough at all. خلاص كمل أنا بعطيك يعني okay go ahead.
الدبرست مود عندك في عندها اللي هو يعني anxious anxiety hyperactive اللي كانت يعني بشكل عام اللي هو
Excuse me, you are not allowed to go out. Please sit.
crackles of the finger
Hey guys.
ايد اليمين كذا يحركها.
You need to work hard, really hard. You need to tell me first the story, and then tell me that, of course, I'm looking, if you are looking, or if you want to diagnose, إنه هذا ذهب، والله لازم يكون لونه أصفر، okay? And then لازم أفحص إنه هذا ما هو faked, right? And then لازم شوف إنه في criteria. If I want to say this is, you said PTSD, I should look for what? Essentially criteria to diagnose PTSD.
PTSD إنه يكون depersonalization, derealization.
أنت حضرت معي؟ Did you attend my lecture about the stress related? Please again. والله العظيم, you will be responsible. قفوهم إنهم مسؤولون. You are responsible. And I told you, please attend. By attending, you will. Anyhow, we say three things. إيش هم؟
life-threatening
واحد
trauma.
واحد بس. إيش هو؟
Life-threatening trauma.
Life-threatening trauma. مظبوط. What else?
Flashbacks.
Flashback.
Avoidance of the event.
Avoidance. At least you need to show me 3 symptoms on your patient, and then I can approve you. How come if I please ask you, please go and treat your brother? This is it, register on. Go and treat your brother who has PTSD. Do you think that you are competent?
No, actually.
I'm sure some other people, they attended, they did their job. They might have performed more, even they can know what's going on here. Look, psychiatry will go, like, for your own career. Please, my job, أمام Allah subhanahu wa ta'ala, to inspire you to attend. If you don't want, whatever the reason, please just apologize. Go and I cannot attend. Go and do something else. But you هتمسك مسؤولية إنه that you will treat your brothers, your sisters, your father, your neighbors, your ummah. يعني I cannot rely on just wallahi doing things like anything. You will be responsible. At least you have PTSD and you didn't attend my lecture. If I were you, either to be in hospital, so I am really have big accident prevented me to attend, this is the only excuse. And this is the only excuse, by the way, accepted by the university and all over the world. Now, okay, let me, I don't want طبعا, of course you need to tell me about how this affected his sex, how is his sleep pattern now, would you sleep his sleep?
He has sleep disturbance.
You need to tell me that. You need to tell me that. You need to report this. You are a reporter الآن. You need to give me what's going on. Give me, yes, I'm convinced that I am a judge, and you are telling me that this patient عنده criminal whatever, okay? أو عنده يعني عنده قضية يعني سوى جريمة. You need to convince me that هو مجرم فعلا. And you need to give me the evidence by reporting. This is the issue of formulation. That you need to learn how to report. Amran. You need to tell about, well, you said even, did you attend my psychopathology lecture?
Yes.
Do you know what is illusion? You said illusion. He has illusion.
Wow.
And what is illusion? Forget about العربي.
يتوهم.
No, tell me what is the definition of illusion. This is how I ask you. And if you don't answer well, sorry, I will not any of you. I don't know any of you before. If you say good things, I will give you good mark. If you are not aware of that, sorry. ما يعني خون لا أمانتي ولا I will not give you a mark without just give me that. Illusion. What is the definition of illusion? I already did my part. I did it. What is the definition of illusion? This is for him. Do you remember?
Yes. اليوجن كانت وهم.
Forget about it. ترجمة. Okay. ترجمة بالعربي. إيش الوهم بالعربي؟ إيش تعرف؟ أنت tell me إيش هذا؟
تخيلات.
إيش هذا؟
تخيلات.
إيش تعريفه؟
يشوف الصور مثلا اشياء غير حقيقيه.
تعتقد إنه طب إيش الفرق بينه وبين hallucination؟
الهلوسة ممكن تصير بصرية.
Please, of course it is not allowed. We should talk in English. رغم أن لا أحب الإنجليز ولا الإنجليزية. Okay? But we have to utilize it. Okay, this is part of the requirements. Illusion, I did it in English. Illusion, what is the definition of illusion?
Perception.
Anyway.
Subnormal perception without with a real external stimuli.
See, it is abnormal perception with a real stimuli. Abnormal perception with a real stimuli. هل هو عنده abnormal perception with a real stimuli?
No, there is no.
That means I cannot say he had illusion. تمام؟
بس انه هو يقول اني انا اشوف السيارة.
I don't care of what he is saying. This is my job here to make sure that is a tadhkur, and I told you, some of the patients will say, I hear voices. I hear voices. All of you now hear voices. But it is not enough to say that hearing voices is hallucination, right? It should be with the absence of the stimuli. With all of my, intimacy to you, and I love my students, but you need to review things, you need to work hard on these things. But tell me the mental state. Do you think that he has suicidal ideas?
لا هو قال لي لا اني انا اذا نمت ما فكرت بالاشياء لا لكن مفكر بحاجة. قال اني احس اني نسيتها صراحة شيء. احس انه شيء مش كانت؟
If you are not forget about it. راح في بيته. لكن this is what I would like you to train yourself. Take it seriously. If you are in the emergency and some suicidal patient came to you, it is your responsibility. You killed him because you didn't discover this thing. It is your responsibility. The government, the ummah, you are taking my money. I gave you money to go and treat these people, not to just miss people. My brother has, for example, PTSD, and he committed suicide. I will sue you. This is your responsibility. Or please say, I don't like medicine. I don't like it, and I will go for something else. You are responsible to make sure if this patient is suicidal or not.
No.
You don't think so? Why?
Because he has anxiety.
If you have an anxiety, that means you will not be suicidal.
No, it can be, but إنه هو كان عنده هو يقول إني أنا أحس إني لما أسوق يقول إذا سكت يقول يتذكر الموقف.
Do you think that will prevent from having suicide? And even if I have anxiety, and I remember, as you are saying, I remember what has happened, but that prevent me of going and kill myself? No. The answer is no. I might be suicidal even if I have anxiety. Okay? Anyhow, further.
Doctor, I'm sorry to interrupt. May I just please go outside and tell the hooligans to lower their voices?
I think at the end of, do you remember the 5 S's?
Yes. Yes.
I told you, please remind yourself or remember, don't forget the 5 S's. اللي هو suicide.
Severity.
6, thank you.
Severity.
Severity. And
Stress.
psychosis. Okay, do you have the psychotic patient? Yes, please. المرة الثالثة, please don't talk. During the practice, I don't want anybody. Please.
لا psychosis لا لأن
He doesn't have psychosis. We are talking about a very serious issue. Does he have psychosis?
No.
Why?
Because
You said he has illusion. Do you think psychosis part of, or illusion part of psychosis?
illusion part of illusion.
Like he has illusion. Do you think he has illusion?
No.
Thank you very much. Yes, he has no, of course. Do you think he has hallucination?
بصري ممكن.
Prove it.
لا عنده تخيلات إنه يتذكر موقف أو.
Forget about, please speak in English. ما في تخيلات كلمة lady or By the way, تخيلات means imagination.
Thank you.
This is totally different from hallucination. Totally different from illusion. Okay? So you think that he is, look, I'll tell you something. You need to train on these things. First of all, how to make, just a story out of any event or incident. This is very important. To make sure, to elicit psychopathology. I will not, he said, والله أنا أوسوس. Let us say that the patient said, أنا بوسوس في قضية. Well, this patient has OCD. Wrong. You need to make sure that you are responsible. Yes, his patient has OCD or obsession or compulsions. Regardless of he doesn't know the definition of OCD, your patient. You are responsible. You spend your time, your life to learn about these things. Come on? So it is my responsibility to make sure this patient is depressed, pathologically, anxious, pathologically, panic, obsessed or psychotic. This is my responsibility. Yes, he is psychotic because of so and so. You need to know. طب خليني انتقل الى شيء اخر. What is your mental state examination for this patient?
عنده low mood.
2 A's, 2 B's, 2 C's.
Okay.
This is systematic.
الابيرنس عنده الابيرنس انها well dressed.
Okay, reasonably dressed.
Reasonably dressed. Okay. And medium hair. Okay.
Forget about this. Okay, he is reasonable. What about the other A? 2 A's, 2 B's, 2 C's. Okay.
الافكت المود.
Okay.
low mood.
Thank you very much. Okay.
عنده المود بنفس الوقت depressed.
Do you think he was depressed?
A little bit.
Okay, yes, I accept it. Okay, what else? عشان الوقت ولا كنت يعني discuss everything. Okay, what else? 2 A's, 2 B's.
And the perception. مدرك للشيء يعني بالنسبة للريسبشن إنه يكون
When we are talking about perception, we are talking about what? Perception.
hallucination.
Thank you very much. Hallucination. في عنده hallucination.
لا.
Okay. What else? في illusion.
لا. هذه السايكوسس. سكيتسو. غير.
No. في عنده forget about when. في عنده who or not. Like stethoscope. Oh, في murmur? No. في whatever, okay? So you need to just, as if you, now you are examining him. This is the mental stage. You are just putting your psychological stethoscope on your patient. Come on? And now you should tell me, yes, ما عنده murmur, ما عنده whatever wheezing, ما عنده whatever. This is your stethoscope. So you are talking about here and now. في hallucination or في illusion. صح? Don't tell me لأنه ما عنده schizophrenia. Nobody is saying about any other disorders. Okay? ما عنده psychosis.
لا ما عندي.
Okay. What about وهذه هنا أنا يعني I would like to discuss this major mistake. What about the third thing? 2 A's, 2 B's, 2 C's.
البي في بي ثاني اللي هي
بي الثاني اللي هي
perception
behavior.
behavior
تمام.
سلوكها.
Okay.
كان شوي يعني أحس إنه في ضغوطات عليه يعني.
Do you remember? Do you remember the list of the background of the behavior?
فيها aggressive وفيها لا.
Thank you very much. Was he aggressive?
According to his story.
Forget about story. In front of you ما تعرف شيء عنه. Describe what is your behavioral stethoscope for this patient. Okay, thank you very much. Yes. No, he was. Okay, what else?
الaggressive إنه كان أعتقد الأورينتيشن هذا في الكوجنيشن.
Thank you very much. Yes, that's in the cognition.
Yes, الأورينتيشن والأورينتد.
No, complete behavior.
طيب البيهافير
So he was not aggressive.
he was not aggressive. He has من عنده فيها shivering.
في?
tremor.
No, tell me. في? I'm asking you.
فيها لا ما عنده.
Okay, thank you very much.
ما عنده.
So there was no tremoring, no anxiety features, okay? Okay, go ahead عشان نروح. C,
C cognition.
okay?
والسي الثانية اللي هي cognition orientation والoriented.
Okay. Do you think that he was well oriented?
Yes.
Did you ask him?
No.
You cannot say that. Cannot tell me والله فلان طيب وحبيب and you didn't.
قال أنت في العيادة الحين.
Thank you very much. This is the point I want to reach.
Place with the time.
Do you think this is the proper question?
No.
You know, close
No.
mouth. What you should say.
What is the day-to-day or
Forget about no. We are talking the place. He said that أنت في العيادة. Wait. Give him a chance. معاذ, look. What is the proper question to ask about? Of course, you need to ask about orientation for patient,
for the time,
time,
place?
place, and person. Thank you very much. Okay, thank you very much. You picked up the place, and you said he asked him about أنت في العيادة.
Maybe
صلي على الرسول. Do you think it is a proper question?
No, it's better for ask.
No, yes or no?
No.
Not bitter or not. This is not.
Okay.
Yes, no.
No.
Do you think that it was?
العيادة. أسئلة.
You asked him أنت في العيادة.
لا أجي أقول لها بسألك أسئلة وإنه
But you told him أنت في العيادة. صح؟ ترجع عنه.
إيه برجع أجي أقول له وين المكان اللي أنت فيه.
تمام أحسن. Thank you very much. This is the right piece bishop. When you are talking about أنت في المستشفى صح؟ This is major mistake. Major. one time, does he know the place? You will ask him, where is the place you are in now? First of all, very open the question and في شيء آخر, not suggesting the question. Thank you very much for picking up this. Because you are, نومك كويس, okay, you sleep, okay. You are suggesting, or you feel depressed, right? This is wrong questions, wrong, major wrong questions. You need to know what's going on.
Asking the patient, are you in the hospital right now? Would that be considered countertransference?
No, this is not at all.
Okay.
Counter-transference or counter-transference, totally different things. That's your feelings toward the patient. Now just you want to know. The idea is, you need to know, is this person aware? You know, when I'm talking about cognitive things, is he aware of time, place, and person? So that means what? He is not aware that he is something wrong. Okay, I will ask about the time.
طيب الآن مثلا وش الوقت الحين؟ هل هو نهار الليل؟
Please start, don't give suggestions to your patients. What if he could not answer you, what is the time now? Just what is the time now? ايش الوقت الآن? If he doesn't know well, or he just, let us say, he'll tell you that it's 12:30. Do you think that? Like this. Well, doctor, it is 12:30. Would you consider him as oriented?
No. No.
Give him a chance.
No, because the orientation إنه شيء إنه يكون جاهز.
Thank you very much. Of course, be careful. This is another mistake. Well, yes, والله يا دكتور عمران it's 12:30. خلاص خلصنا من الموضوع. No. You are reading. No, you are reading from your watch. You are not aware of the time, or you didn't give me a sense that you are aware of the time. Okay? Yes, I'm aware of the time. Today, now is almost Dhuhr prayer. We will already pray, or we have not prayed yet. Al-Dhuhr, not al-Sabh. Okay? This is very important. The idea is just to see what's going on with this patient. His mood, his appearance, at the end, you will have an idea that this patient is mentally retarded. This patient is whatever. This patient is not aware of the surrounding. So orientation means, is he aware of the surrounding? Place, you should ask him, where are we now? Don't suggest. والبصير يعني أسوأ من كذا. If you go and you see your patient is elderly and his relative will say, well, doctor, he will suggest to his father, ما عرفنا تونا صلينا يا بابا. يا أخي لا تعاشر. I'm not asking you, I'm asking my patient. Let this relative go out. See your patient alone. If he is really interfering with you, you want to know, is this patient aware of the time or of the... طيب, the last things, person. Do you think that this patient is oriented for person?
ممكن أقول لأن هو قال اسمه.
You didn't ask.
بالبداية.
Anyhow, usually how, do you know how to ask? Straightforward, I didn't expect a PTSD person to lose his orientation, right? It is not in the criteria, it's not. So my first impression is PTSD, I should just go for طب أشياء كثيرة لكن let us just, I will ask, this is a last question about mental state. I will ask about his orientation for a person.
ممكن أسأل أقول تعرف مين أنا اسمي؟
Thank you.
أو تتذكر اسمي؟
Or do you know what is this nurse working? Of course, you will not mention the nurse by itself. Who is this? What is person's working? What is his career or her career? Okay. Okay. We have just started. للأسف يعني أخذنا وقت طويل what is your differential diagnosis? طبعا now we finished the history, we finished the examination, mental state examination, 2Bs, 2Bs, 2Cs. Now we will reach the provisional diagnosis, okay? What is your provisional diagnosis? You said it, PTSD. Thank you. Why? Because of three things. The criteria of PTSD. Avoidance, thank you.
الثاني اللي هو لوز لا تروما.
Trauma.
الثالث اللي هو إن ناسي الفلاش باك.
Flashback, thank you very much. Yes.
أو عفواً.
So this is, yes, okay. So what is the differential diagnosis? كنت معي بالانالوج اللي الميتافور اللي قلت عمر جاي من بعيد ولا how to do differential diagnosis? You did not. How you will make differential diagnosis for PTSD? Believe me, nobody will teach you like this. This is very vital things.
ممكن general anxiety.
Thank you very much. Yes, I accepted generalized anxiety disorders. Why?
لأنه هو anxious.
Thank you very much.
الهرمون.
You expect to be anxious. He was depressed, not anxious, right? But yes, you're right. Since we are dealing with anxiety, stress related, كانت بالأصل هي أصلا anxiety under the umbrella of anxiety. Now they move it to be stress related disorders. Okay, generalized anxiety disorder, another one.
ممكن عنده فوبيا من
Could be phobias. This is another spectrum of anxiety.
فوبيا من السيارة نفسها.
بلاش phobias. Yes, you're right. Okay. بس أعطيني another diagnosis. He mentioned that. And you found that. Something you found in the history. Or something you found in the mental state examination. Then you will put the differential diagnosis.
ممكن drug addict.
Did you,
alcohol.
well, did you notice anything? لما تجي أنا رجال محترم وجاي عندك العيادة قل لي والله you are أنت رجال حشاش. I will kill you. Okay? Why you said he is حشاش? As if you are saying that he, والله مسكين وحبيبي حشاش. Why you are saying drug addict? Prove it.
لأنه يقول إني أنا أشرب زجاجة أو شيء خلال يومين يعني.
Alcohol.
الكحول.
No, I missed that. You said that? والله معناتها حشاش ونص حشاش. Okay, yes, in this case you are right. How we treat this patient? Before.
drug addict.
صلي على الرسول صلى على الرسول. Before. I know that you want to go, I understand that. But what investigation will you do for this patient?
Investigation.
Yes.
نسوي له cognitive behavioral therapy.
I will kill him, okay?
هذا treatment now. Investigation إنه يسوي له.
What you will do for his investigation?
نسوي له cognition. إحنا وصلنا للcognition C.
Okay, I hope that
Differential
I will.
diagnosis. طيب. الانفستيجيشن ايش الاجراء اللي بسويه يعني؟ لا.
تحليل.
Investigation.
تحليل. ممكن اسوي له ثايرويد.
شوف, I hate this ممكن, you know. Usually I make big discussion on ممكن. I don't like ممكن. Okay? Either to be firm, I will do that. يعني حتروح تطلب له هذا ولا لا. وإذا ما في عندك justification, please, we are here. Please the mobile. We are here just to learn how to be scientist. You are scientist. You will go and do the thyroid function test. Why?
Because he is acceptable.
You are expecting what?
Hyperthyroidism.
Hyperthyroidism. Why? Because of anxiety symptoms.
Anxiety.
Yes, this is the rationale I would like you to go through. Okay? What else? Another investigation. حأعتقد صراحة يعني. Okay.
طيب مو ممكن اكيد اسوي له.
Thank you very much. لانه ممكن نسوي له اكس راي ليده، ممكن نسوي له اكس راي لرجله، ممكن نسوي والله وات ايفر، لكن legitimize it.
طيب.
Why؟ ليش بدك تسوي يده اليسار ما فيها شيء ما شاء الله تبارك الله؟ Why you will make X-ray for it؟ لأنه ممكن. This is why I don't like ممكن. If you are, why not to do X-ray for his sons of his? Okay, why not to do X-ray for his back? ممكن. Please get rid of this ممكن. If you have justification, say it. If you don't have justification, keep silent. Okay? What else? واحدة very straightforward, you said it.
اسوي له فيتامين بي 12 تحليل دم، فيتامين بي 12، فيتامين دي، لانها لها علاقه بالانكزايتي.
فيتامين بي 12 له علاقة بالانكزايتي.
لا الفيتامين دي عفوا، فيتامين بي 12 لا عفوا اسوي له اللي هو فيتامين دي اللي اسوي له اكيد، واسوي له تحليل لا بس هذا.
I never did vitamin whatever a screening for my PTSD patient. You are until لما حيجي يبعث يعني يروح إلى وزارة الصحة ويشتكي عليه، يقول هذا الرجل متعاون مع مدير المستوصف عشان ياخذ فلوسي ويسوي تحاليل ما لها داعي. No, you don't have justification. You don't. Usually we don't do vitamin D or whatever. It is not, could be depression, could be whatever. لكن it is not regular, you know, investigation. Very famous, very straightforward. You said it. Straightforward. يعني بده يكون عندك شيء. والله when I was at your age, if I request an X-ray for or whatever, البيليروبين مرارة واضحة and إذا جيت negative I feel guilty. الناس تدفع. واحدة جالسة في حفر الباطن وأنت طلبت لها أنها تجي والله جات عندك الرياض وطلبت لها أن تسوي whatever X-ray for whatever. حتكلم ابنها اللي في الجنوب مسكين العسكري ياخذ إجازة ويجي عندها يجيبه ويجي عندك الرياض. تدفع تكلفة هذول الناس كلهم. وبعدين please make sure that when you are saying something, that means you are you know spending much time of and much life of this. You are stealing the life of these people. Okay. في شيء مهم. في شيء. No, I will not do that. No, X-ray for what? الآن في قضية مهمة. You said that he is.
ممكن عنده brain tumor. delirium.
Do you think that he is delirious?
No.
Didn't you? I think we need to stop here. لكن what's the investigation? Straightforward.
Urine analysis.
Thank you very much. Urine analysis. حشاش هذا وجاي عندك ويشرب معك. Immediately do urine analysis. مظبوط? Okay, how to treat how to treat this patient?
الكحول نعطيها antidote.
What you give them?
ميثانول أو ميثانول. not sure.
تعتقد هو عنده alcohol?
He is alcoholic.
Intoxicated or withdrawal?
لا withdrawal.
ايش اسمه withdrawal of alcohol؟
withdrawal إنه يستخدم الفترة.
ايش اسمه اسمه له ترم معين اخذتوه في الميديسن والان تاخذوه الان يعني في له اسم معين. alcohol withdrawal. What you call it?
هو مش إدمان، مو مش addiction.
Then how you treat him if it's not okay? Please, if you are here, if you see anything, be careful. اوقف بحل يعني ما لازم you need to justify it for me. Okay? If you don't know, it's better to keep silent. And this is in front of any examiner. If you are not sure about something, don't say it. Please, Amran, and please.
So I'm reading the slide, so he will finish
I'm
the
writing
slide.
notes.
We are here now. Of course, you will not, you said that he is in withdrawal. أنا ما حأدخل عشان ما عندي وقت يعني عارف كيف؟ لكن هل في أي أعراض أنت عارف إيش اسم هذه withdrawal of the alcohol؟ سكرت؟ حط الثاني.
Delirium tremens.
Delirium tremens. Is he delirious? Tremens now? No. So how you will treat alcohol withdrawal without having this case? Okay, what else? Now I'm saying what is, how we will treat this patient. هذه آخر سؤال حسألك. Usually I don't take this long time.